Welcome back to the Best PT Podcast. This is episode 5.4, talking about burns. 4 different types of burns: thermal, electrical, chemical, and radiation burns. Different zones of injury occur with burns. The zone of coagulation is the area of the burn that receives the most severe injuries. Cells in this area have irreversible cell damage. The zone of stasis surrounds the zone of coagulation with less severe damage, although the damage here can be reversible. And the zone of hyperemia is the area surrounding the zone of stasis. This is an inflamed but minimally damaged zone. The cells here will fully recover. Classifying burns. Superficial burns affect the outer epidermis only. These are red with slight edema. Healing occurs without scarring in 2 to 5 days. Superficial partial thickness burns cover the epidermis and the upper level of the dermis. They can be very painful and often blister. Healing occurs with minimal or no scarring in 5 to 21 days. Deep partial thickness burns. The epidermis is completely destroyed, as is most of the dermis. These present with broken blisters, edema, and nerve damage. They can present with hypertrophic or keloid scarring. Healing takes 21 to 35 days. Full thickness burns involve the complete destruction of the epidermis, the dermis, as well as partial damage to subcutaneous fat. These have eschar, although are minimally painful due to the large amount of nerve destruction. These burns require grafts and take months to heal. Subdermal burns involve the complete destruction of the epidermis, the dermis, subcutaneous tissues, and may also involve muscle or bone. These burns require multiple surgical interventions, grafts, and extensive healing time. Approximating burn coverage, the rule of nines. The head and trunk is 9% of the body. The anterior trunk is 18%. The posterior trunk is 18%. The bilateral anterior upper extremities are 9%. The bilateral posterior upper extremities, 9%. The bilateral anterior lower extremities are 18%. And the bilateral posterior lower extremities are also 18%. And last but not least, the genitals are 1%. Scar management. Splinting locations to avoid scarring. The anterior neck often results in cervical flexion and side bending contractures. Can be modified with a soft collar, molded collar, or Philadelphia collar. The anterior chest and axilla region often involve shoulder adduction, extension, and internal rotation contractures. Axillary or airplane splints and shoulder abduction braces should be used. The elbow often involves flexion and pronation contractures. Gutter splints, conforming splints, 3-point splints, and air splints should be used. The hand and wrist can have multiple types of contractures: extension, hyperextension of the MCP joint contracture, IP flexion contractures, and thumb flexion and adduction contractures, as well as wrist flexion contractures. Wrist splints, thumb spica splints, and palmar or dorsal extension splints should be used. In the hip, flexion and adduction contractures are common. Anterior hip spica casts or abduction splints should be used. In the knee, flexion contractures are common. Use conforming splints, 3-point splints, or air splints. And finally, in the ankle, plantar flexion contractures are common. Use posterior foot drop splints or ankle conforming splints. Assessing a scar, you can use a tonometer or objective rating scales. You should always document the location, sensation integrity, texture, pigmentation, vascularization, pliability, and the height. Scar massage. Friction massage can loosen adhesions, but do not begin scar massage too soon or too aggressively, as you can reinitiate the injury and inflammation cycle. Use a slow and firm technique. Compression garments are recommended for any burn that will require more than 14 days to heal. Sustained compression should be 15 to 35 millimeters of mercury of compression. They should be applied for 22 to 23 hours per day, and they should be applied for burns that take 2 weeks to 2 months to heal, and after wound or closure graft, up to 2 years. And finally, topical burn agents. Silver sulfadiazine. The advantages are that it is a painless, broad-spectrum agent with direct wound application and effective against yeasts. Disadvantages: it does not penetrate into eschar. Silver nitrate. Advantages: broad spectrum, non-allergenic, and painless. Disadvantages: poor Poor penetration discolors skin and can cause electrolyte imbalances. Iodine advantages: broad spectrum, antifungal, and easily removed with water. Disadvantages: painful, impairs thyroid function, and ineffective against Pseudomonas, which are a common hospital pathogen. Mafenide acetate advantages: broad spectrum and penetrates eschar. Disadvantages: can cause metabolic acidosis, compromise respiratory function, inhibit epithelialization of wounds, and is very painful. Gentamicin, the advantages are that it is broad spectrum and can be covered or left open to air. Disadvantages: it can cause bacterial resistance, and it is toxic to both the kidneys and the vestibular system in a phenomenon called ototoxic. And finally, nitrofurazone. Advantages: it's bactericidal and broad spectrum. The disadvantage is that it can cause an overgrowth of fungus and can be very painful. That's it for episode 5.4, talking about burns. Episode 5.5, we'll talk about skin grafts. As always, the outline will be in the show notes. Thank you for joining me.